Maria Silverman. Mira Silverman. Please, welcome. Got to be quick. Thanks. I mean, just getting up to recognize. Okay, take your time. 2 minutes.
Thank you. My name is Mira Silverman. I'm a registered nurse in the state of Rhode Island. I've worked with many segments of the population, from newborn babies all the way to the elderly. I currently work as a nurse home visitor in maternal and child health. And I believe that the licensing of naturopathic doctors is fundamental to the development of a quality integrative healthcare system that meets the needs of Rhode Island residents. It's estimated that up to 70% of the U.S. population now uses some form of natural complementary or alternative medicine. The face of healthcare is changing very rapidly. We have seen more and more chronic diseases that cannot be fully healed or fully managed by pharmaceuticals. We have epidemic levels of cancer, diabetes, mental illness, Lyme disease, autoimmune diseases. And people are using vitamins and herbs and other natural remedies as a way to empower themselves in their health and wellness, whether it be as prevention or as treatment. I've seen many of my patients experiment with herbs and vitamins based on things that they read on the internet, or they meet with things like Herbalife, or they walk through the Whole Foods aisles and they just grab things to try. And if they have any kind of negative reaction, they don't have a trained professional that they can talk with, or I don't feel like I can refer them to somebody if it's not a licensed practitioner. I think there is a great demand for well-educated practitioners in this state who can guide patients in nutrition and natural remedies, and licensure would regulate the qualifications of practitioners and would keep those practitioners who are dedicated to providing much-needed integrative care working in the state of Rhode Island. I believe that people have the right to choose what kind of health care they want for themselves, but currently Rhode Island residents who choose naturopathic medicine must either have the money and mobility to travel to Massachusetts or Connecticut, or they must choose to work with unlicensed practitioners in Rhode Island who must jump through hoops trying to practice to the full extent of their training, trying to find doctors who will order the kinds of tests NDs use to obtain a more complete picture of their patient's health.
That's 2 minutes.
Thank you, Ms. Silverman. Are there any questions for Ms. Silverman? Thank you very much for your testimony.